welcome all of you to the first New York Prostate Cancer Summit. What is the goal of this summit? One is to educate our patients and their caregivers and families about prostate cancer and to build awareness of what's happening in terms of what patients can do and what some of the latest and greatest research is.
Nothing beats a live in-person discussion, in my opinion. And when you gather the experts, and the experts aren't just doctors and providers, it's everybody who's in the game. Everybody has a point of view, everyone has stuff to educate each other with. When you get us all together to talk about it and really learn from one another, it's a whole different experience.
It's good to see 4 institutions come together. So just to have that knowledge in one room, very refreshing. But also there was a lot of talk on diet and lifestyle, things that a person can take control over to battle their disease. You got to educate yourself. Make the time to attend a conference like this.
We're very fortunate to have a very diverse program today that includes experts in the field of psychiatry, nutrition, as well as some of the experts in the field of prostate cancer imaging, diagnosis, screening, and patient treatment. So we're very, very pleased that everybody has been able to come from multiple institutions and share their information with patients and their families.
So chemotherapy works better when you have less cancer. Hormonal therapy is not so clear. Hormonal therapy works reasonably well regardless of the PSA.
I would like patients and their family members to go home with some more understanding of the disease spectrum and the different treatments. There's a lot of promising research, a lot of new kinds of therapies and combination therapies. The way to access those kinds of things on the earlier side is through the process of clinical trials. I also hope that they realize they're not by themselves, right? That there's a community of people out there, doctors, nurses, caregivers, support organizations trying to help them get through prostate cancer.
This summit was by far the best that I have attended. I think being in a group this size makes you feel less isolated, makes you less prone to go down the why me, path. It's a place where you can get some ideas and also some hope.
One of the fun things about the summit was the number of my patients came, and universally they came up to me and said, "Thank you very much. I learned so much. This is really great and a great experience." I think it goes a long way for them and for the whole prostate cancer community.